Hi, I'm Clarissa from OurDoctor. Today, we will be diving in a case study on ED warning signs and how it can be more serious than you think. A man visits the clinic seeking help for his erectile dysfunction, hoping for a solution like testosterone or Viagra. However, he is unaware that this issue is a symptom of a more significant underlying problem that has been developing for over 15 years. He's tried natural methods to boost testosterone, such as exercise, weight loss, vitamin D supplementation, and improved sleep, which have provided some minor improvement. However, I propose a solution that can significantly alleviate the problem. The primary cause of his erectile dysfunction is reduced blood flow to his genital area, which prevents his penis from achieving the necessary firmness for penetration, resulting in a flaccid state. Let's explore the reasons behind his occurrence and discuss preventative measures. Consider an image of an artery that has been longitudinally sectioned. Take note of the different layers of living tissue that make up the artery and carry the flowing blood. Arteries consist of layers of muscle and skin that need to be in optimal health to ensure proper blood supply to organs. The skin layer is smooth, while the muscle layer is thick and contracts and relaxes based on the body's needs. In a healthy individual, the artery appears as depicted in the image. Unfortunately, in this patient, a significant problem has been quietly developing, initially appearing normal, but with early signs of disease that went unnoticed. These signs manifest as fatty streaks within the layers of the artery. They show no noticeable symptoms and can only be identified through biopsy and examination of the artery's interior. A few years later, testing his cholesterol levels would reveal elevated blood cholesterol in the clinic. This heightened cholesterol indicates that cholesterol, a fuel source, is being transported through the bloodstream. It originates from the liver, enters the bloodstream, and ideally reaches various fuel-dependent tissues in the body. After delivering its fuel, it should return to the liver. The time cholesterol spends in the bloodstream is known as its residency time. Healthy individuals have a low residency time, indicating that cholesterol circulates briefly. It enters the bloodstream, provides fuel, and promptly returns to the liver. However, unbeknownst to this patient, his residency time was abnormally high, evident from markedly elevated cholesterol levels. Simultaneously, the fatty streaks continue to thicken and accumulate further disease. The next stage involves a more advanced level of pathology, as the patient's white blood cells and red blood cells attempt to mitigate the condition of the artery wall. When the liver's storage capacity is exhausted, the artery wall serves as an oversized storage site for cholesterol deposits. The situation needs to be reversed, and the reversal is initiated by white blood cells and red blood cells that invade the fatty streaks, attempting to repair the damage. If one could touch that region of the artery, it would feel tender, inflamed, and slightly painful. However, the interior of arteries cannot be felt. This progression leads to the first visible evidence of the problem. As white blood cells and red blood cells engage in the cleanup process, they leave behind debris, particularly calcium. These calcium deposits within the arterial wall become visible through specific and intense X-ray imaging. At this stage, the problem has been going on for at least 5 years, yet the patient remains unaware of the impending erectile dysfunction and other more serious consequences. Now we witness a significantly worsened condition for the patient. Observe the considerable thickening and discoloration of the artery wall compared to the initial state. The artery wall has thickened and developed scarring due to the fatty streaks, white blood cells, and calcium deposits. All of these are worrisome signs. Considering the patient's situation, the blood flow through the penile artery remains relatively robust. However, the disease within the artery wall is on the verge of erupting, a situation unrelated to discussions about the penis. This eruption appears like a pimple, with a central white dot surrounded by tenderness if observed through a camera. The danger lies in its volatility. The subsequent event for this patient involves the eruption of this tissue into the blood supply, which is severely detrimental, triggering a reaction within the body. Platelets and fibrinogen, tiny particles within the body, work to manage this crisis in his penis. As a result, the blood supply begins to slow down until it eventually comes to a complete halt. This cessation of blood supply is crucial to keep the tissue in this area alive. Ideally, the body would find a way for blood to bypass the blockage. Without the restoration of blood flow, all tissue downstream from the blockage will perish. If this arterial blockage occurred in the heart, it would be called a heart attack. In the brain, it would be labeled a stroke. However, when it occurs in the penis, the patient may only experience temporary pain for a few hours. It is highly unlikely that he would openly discuss this painful sensation in his penis, especially if a small amount of blood supply manages to return. Nevertheless, this restricted blood flow is the reason he seeks testosterone or Viagra. However, with such low blood supply, achieving a firm erection becomes impossible. The blood flow is reduced to a mere trickle. Moreover, the part of the artery responsible for relaxation and facilitating ample blood flow into the penis for a firm erection can no longer perform its function. Reintroducing testosterone hormone will not yield significant improvements for this patient. The issue he faces are far more severe, affecting his entire body. Although the tissue images presented were originally used to illustrate heart attacks or strokes, it is crucial to recognize that arteries supplying the heart, brain, and penis are interconnected. When this man attributes his erectile dysfunction to testosterone, I suggest that he should focus on a different hormone, insulin. Determine whether insulin levels are elevated. Consider these 5 predictors: triglyceride levels, HDL levels, blood pressure, waistline measurement, and blood sugar levels. With all this, I am deeply concerned about the imminent risk of a heart attack or stroke, which is a grave danger that this individual is completely unaware of. There is a ton of information yet to be explored. If you have any questions or concerns, give us a call. We're here to help.